Welcome to the course on medical law. This lecture will be about clinical establishment laws. The concepts covered in this lecture are clinical establishment. In this, the legal regulations governing the establishment of medical service providers will be covered in this lecture. In addition to this, the other aspects of clinical establishment like the regulations on blood banks, regulations on clinics which provide transplantation of human organs, medical termination of pregnancy, clinics that specifically provides psychiatric services, and what the clinic has to comply when they are dealing with narcotic drugs and psychotropic substances, and the biomedical waste disposal regulations governing clinical establishments, and rules related to ultrasound equipments. The keywords of this lecture are clinical establishment, registration and regulation, clinical services, diagnostics, devices and equipments. There exist multitude of regulations that ensure the adherence to appropriate registration procedures during the construction of hospital facilities. These regulations are intended to guarantee the safety of public who are utilizing these infrastructures and also the workforce who is employed in these hospital facilities. The legal regulations requires prior registration before initiation of clinical service facilities. Apart from this, periodic inspections will also be conducted in the premises to ensure compliance with the legal regulations. The Clinical Establishments Registration and Regulation Act 2010 is the main legislation that provides for registration of all clinical establishments. But this 2010 legislation is a central act. Apart from this central legislation, there are also several legislations existing at the state level. So, Clinical Establishment Registration and Regulation Act 2010 is not applicable to all the states in India. It is applicable to only those states who have accepted this legislation. This legislation allows for registration and control of clinical establishments throughout the country with the intention of prescribing basic minimum criteria for the facilities and services of certain type that are provided by clinical establishments. The primary objective of this legislation is to develop a comprehensive database comprising of clinical establishments and to ensure their accessibility and functionality. The primary aim is to enhance the quality of public health by eradicating unqualified practitioners. So, all the clinical establishments are required to register themselves under the Clinical Establishments Registration and Regulation Act of 2010. But it has to be kept in mind that this legislation may not be applicable to all the states in India. Those states who have accepted this legislation, the service providers in those states will have to register under this legislation. Who is covered under the provisions of this legislation? The Clinical Establishment Act applies to clinical establishments, both public and private, covering all recognized systems of medicine. So, it covers all different types of clinical establishments, including those operating in public sector and private sector. This is also applicable to all systems of medicine, including Ayurveda, Yoga, Unani, Naturopathy, Homeopathy, etc. This includes many entities that are either owned, controlled or managed by government. It can be a public or private trust or business which are registered under central, provincial or state acts, regardless of ownership. So, whether it is government owned or privately owned, they are covered under this Clinical Establishment Regulation and Registration Act. Even establishments that are owned by municipal authorities or even individual medical practitioner is also covered under this legislation. This act does not include clinical establishments that are owned, controlled or managed by the armed forces. So, only exception from this legislation is those establishments which are owned, controlled or managed by armed forces. What is a clinical establishment? This is defined in section 2C of the Clinical Establishments Registration and Regulation Act of 2010. A hospital, maternity home, nursing home, dispensary, clinic, sanatorium or any other facility that provides services or facilities needing diagnostics, treatment or care for disease, injury, deformity, abnormality or pregnancy is covered in section 2C. So, all those establishments which provide hospital services or maternity services, nursing home, dispensary, clinic, etc. are required to be registered under the Clinical Establishments Registration and Regulation Act of 2010. This also includes diagnostic centers and laboratories which provide forensic, bacteriological, genetic, radiological, chemical or biological investigations. So, all hospitals, diagnostic centers or laboratories are covered in section 2C of the Act, meaning that they are considered as clinical establishments under the 2010 legislation. The salient features of the Act. The Act facilitates creation of a dependable and inclusive database or a registry for various clinical establishments across the nation at the district, state and national levels. So, this legislation provides for registration of all establishments which operate hospital services. This results in creation of a database which covers all the details of service providers in healthcare sector. The legislation facilitates the categorization of different therapeutic establishment and establishes fundamental minimum standards for each category. The legislation allows the government to come out with minimum standards that has to be followed by all clinical establishments. Only those establishments which qualify those minimum standards will be able to register under the 2010 legislation. This Act establishes minimum criteria for operation, employing a participatory and collaborative method to guarantee consistency among all enterprises. The minimum standards covers essential requirements that are mandatory in nature. The Act also facilitates acquisition of information and data by government from clinical facilities for the purpose of public health actions such as outbreak and disaster management. It also provides for establishment of various multi-stakeholder entities, including the National Council for Clinical Establishment at the national level, the State Council at the state level and District Registration Authority at the district level. So, this legislation provides for granting the government with the powers to seek data from various clinical establishments. So, in case the government requires access to information from those clinical service providers to handle any outbreak or cases of disaster management, the government is empowered under this legislation to acquire such information. This legislation also provides for establishing several institutions at national, state and district level. At the national level, there will be a National Council for Clinical Establishment. At the district level, there will be District Registration Authority, and in the intermediate level, that is the state level, there will be a State Council for Clinical Establishments. The legislation provides for permits based on two stages. Initially, when the clinical service provider starts the operation, they can apply for a provisional registration which can later be converted into a permanent registration. So, provisional registration is achieved via self-declaration process. So, there is no need of any inspection or inquiry for grant of provisional registration. So, any entity which is starting clinical service providing business has to acquire provisional registration before they start the operation. This is on the basis of self declaration process and is granted without any inquiry or inspection. The process of permanent registration involves categorization, classification and communication of minimum standards specific to each category. So, permanent registration will be granted only on the basis of compliance with the minimum standards which is provided under this legislation. This act mandates the disclosure of registration procedure and clinical establishment data to the public. So, this ensures that public will have access to information related to various clinical service providers. The Act also mandates the disclosure of registration procedure and clinical establishment data, thereby promoting transparency. The rates and available facilities has to be openly exhibited at a conspicuous location within each establishment. The establishment of a registry for clinical facilities is going to be beneficial for the development of policies and distribution of resources. The cancellation of registration may take place if the clinical establishment is not complying with the conditions for registration. Thus, the Act provides that in case the clinical establishment is not complying with the conditions of registration, then the provisional or permanent registration granted to them can be cancelled. The clinical establishments registered under this legislation also have a duty obligation to provide immediate medical care in case of emergency situations. So, this is a duty imposed upon clinical establishments registered under the 2010 legislation. This they have to take care within their limitations of personnels and resources. The Act is applicable only to clinical establishments associated with recognized system of medicine. So, recognized systems of medicine like the modern system of medicine, Ayurveda, Unani, Siddha, Homeopathy, etc. are covered under this legislation. So, irrespective of the system of medicine in which they are operating, they have to register under this legislation. But this is only limited to recognized systems of medicine. So, if any person or any clinic is providing medical services which is not coming within the recognized systems of medicine, then they cannot register under the 2010 legislation. So, this provides for regulating and discouraging quackery because they cannot register under this Act. The legislation establishes requirements for healthcare providers to preserve records and reporting in accordance with defined guidelines. So, this Act also requires clinical establishments to maintain all records of their data and also report this to the governing bodies that is existing at the national level, state level and also at the district level. Apart from the Clinical Establishments Regulation and Registration Act of 2010, there are also several other legislations which are applicable for clinical establishments. If the hospital is possessing a blood bank, then they are also covered under the Drugs and Cosmetics Act. They have to adhere to the space, manpower and equipment criteria which is outlined under the regulations issued under the Drugs and Cosmetic Act. In order to establish and operate a blood bank, it is necessary to obtain a license from the Drug Standards Control Organization which is established under the Drugs and Cosmetics Act. The presence of blood bank within a hospital is also a prerequisite for this requirement. The initial validity of this registration will be for a period of 5 years. So, if the clinical establishment is having a blood bank, then they have to comply with Drugs and Cosmetic Act as well, in addition to the Clinical Establishment Regulation and Registration Act. If the clinical establishment is carrying out any transplantation of human organs, then they have to comply with the Transplantation of Human Organs Act of 1994. So, any hospital who is engaging in human organ transplantation or organ harvesting are required to undergo registration under this 1994 legislation. The registration for transplantation is granted based on availability of necessary infrastructure required for successful execution of the procedure. So, the registration under this act will be granted only after an inquiry to ensure that the clinical establishment has adequate facilities to handle successful execution of the procedure. If the clinical establishment is providing for termination of pregnancy, then they have to comply with Medical Termination of Pregnancy Act of 1971. So, in order to engage in practice of medical termination of pregnancy, hospitals are required to get registration within their respective state under the 1971 legislation. The approval for conducting medical termination of pregnancy will only be granted once the registration process is completed. The clinical establishment has to comply with regulations outlined in this 1971 Act in order to conduct safe and legal termination of pregnancy. The approval for medical termination of pregnancy is granted in two different categories. Category A deals with scenarios where operation theatre facility is not required. Category B deals with situations where an operation theatre is required. So, depending upon the type of the clinical service that the clinical establishment is providing, they have to register either under category A or category B. There are also clinical establishments which provide for psychiatric services. Hospitals that offer specific treatments such as de-addiction, psychiatric problem treatment, child and adolescent psychiatric clinics, they are all required to register themselves under the Mental Healthcare Act 2017. So, if the clinical establishment is providing services which are specifically related to psychiatric services, in addition to the Clinical Establishment Regulation and Registration Act, they also have to comply with the Mental Healthcare Act of 2017. If the hospital establishment is dealing with any narcotic drugs or psychotropic substances, then they have to also comply with the NDPS Act of 1985. The hospitals that employ the use of narcotic drugs and psychotropic substances for patient care are required to acquire the license under the 1985 legislation. Here, they are regulated by the state's Food and Drug Administration Department. This license will delineate the specific quantity and category of narcotic drugs and psychotropic substances that are permitted and necessitates periodic renewal of their registration. So, this means that if the clinical establishment is required to possess any narcotic drug or psychotropic substances for the purpose of providing clinical services or treatment to their patients, then they have to acquire a license under the NDPS Act. So, without acquiring a license under the NDPS Act, they are not allowed to possess any drug which is regulated under the 1985 legislation. Once they apply for registration, then the specific quantity which they are allowed to possess will be specifically mentioned in their registration. All clinical establishments will also have to deal with biomedical waste. So, biomedical waste disposal is also a legal requirement. The acquisition of authorization from management of biomedical waste from the Pollution Control Board is necessary for operating a clinical establishment. To receive the authorization, it is necessary to establish a partnership with common biomedical waste treatment facility operator. In every region, there will be a central biomedical waste treatment facility that have been duly approved by the government to undertake the management and disposal of biomedical waste. So, apart from all other legal regulations under the Clinical Establishment Regulation and Registration Act, and also based on the specific service that they are providing, they have to comply with other legal requirements. But in addition to all this, if there is possibility of generating biomedical waste, they have to register themselves under the Environment Protection Act and also take the necessary approvals from the pollution control boards. If they are having ultrasound equipment within their hospital premises, then they also have to comply with Preconception and Prenatal Diagnostics Methods Act of 1994. This act was made by the government to rule over all healthcare facilities that have ultrasound equipments. The act also says that all radiologists, sonologists and doctors who use USG machines must have their names written in the certificate or on different sheet that must be shown with the registration certificate. So, all hospital facilities which are having ultrasound equipments also have to register themselves under this legislation and then comply with other legal requirements. To conclude, the healthcare system in India is characterized by universal care system that is administered by constituent states and territories. So, apart from the central legislation, that is the Clinical Establishment Regulation and Registration Act of 2010, there are also several other state legislations that hospitals have to comply with. As I told in the initial slide, the Clinical Establishment Regulation Registration Act is not applicable all over India. It is only applicable to some specific states. So, those states who are not following the 2010 legislation have enacted their own state legislations for providing for the registration of hospital establishments. So, if you take for an example, West Bengal has a state legislation to provide for registration of clinical establishments. So, that means a clinical establishment operating in that state will have to register under the state legislation. Apart from the central legislation dealing with the registration of clinical establishments, based on the specific service that a clinical establishment is providing, they have to comply with different other legislations. The references of this lecture can be seen here. Thank you for listening to the lecture. I hope you are enjoying the course.